First, I'd like to say thank you, Dr. Morante, for helping me pass the ANCC exam. I did take the Flex crash course, I did the question banks, and the one-on-one was super helpful, especially with the fast facts that were provided. I'd like to thank you, Dr. Morante, for being such a supportive preceptor and mentor throughout my process. Your knowledge and experience and compassion are top-notch, and I'd recommend you to anybody. So again, Dr. Morante, thank you so much for being so supportive, and I am thankful that you were my preceptor, and the classes that you provided were very informative and really helped me to pass the test. So I just wanted to say thank you.
Thank you to Dr. Morante for always being my cheerleader. His live review class was very informative, and the Q banks were hard that they honed my critical thinking skills and strategies for test taking. Dr. Morante has been very supportive, and his wisdom was always on point. Thank you for everything, Dr. Morante and Pass NP, for helping me pass my ANCC PMHNP certification exam.
I passed! Thank you so much, Pedro Morante, for everything. For your mentorship during all of my clinical hours in my DNP program, for the pass course that allowed me to have the confidence to excel at the PMHNP ANCC boards the very first try.
Remember your 2-2-1 rule, okay? All those questions that are difficult, sometimes they are non-scored, so don't stress about it. You should be great, and always trust the process, enjoy it. You're gonna be gonna be creating an impact to the community. Remember, it's not just to pass, but also to lead by example, to create an impact to the community. We're gonna celebrate tomorrow because you're gonna be a psych mental health nurse practitioner board certified from the Bay Area, California.
Oh my God.
Congratulations. Did you pass your board today? Wow.
The exam was very tricky. Some of the questions on your review was there. Good luck to the rest.
Yeah.
Okay, guys.
Attended our live class too in LA, right? The one in Koreatown.
Yes, I was in live class.
That was our live class. Congratulations. There you go. Ledi Loot from California. Psych Nurse Practitioner Board. So proud of you from being my student to colleague.
Thank you, Dr. Morante.
Now, psych.
You guys,
board practitioner.
Dr. Morante is really amazing. He lets you be very independent, and you're gonna use a lot, because not a lot of preceptors would allow you to like do hands-on with patients. And you know, with Dr. Morante, it's like one of the best trainings I've ever had, because I learned how to create my care plan, and then just give like, you know, he would give input if you're doing the right thing or not. So that was really good.
Oh my God, I have to mute my mic. Hello, everyone. Welcome back. Let's see who's here today. If you're joining us wherever, Facebook, LinkedIn, Instagram, go ahead and put it on the comment box where you're watching us from right now. Where are you studying from? So we are doing the second part of our antipsychotic discussion because I had to leave early last time. So there's been like requests for more. So we're doing it today. I have nothing else to do but to help you guys. For those who are new here today, welcome to our Lock It In Live. It's a free review sessions that we do on several social media platforms to help future psych NPs to pass the board exam. And then if you haven't, please go ahead and follow us, subscribe. And also, I'm going to be sharing very important free resources. Very free. Free. I love free. So, yes, welcome back, welcome back. And for those who are new here, welcome to our PMHNP Lock It In Live. Hi, Jan, welcome back. Hi. Oh, Pilipino, kumusta po? Welcome. Mabuhay. So we have Jan from Baltimore. We have Mancolas from Maine. All right. So we are doing another episode of the antipsychotics. We'll be discussing very high yield topics about this medication. It's heavily tested on the board exam. And so also, let me see. We are also, for those who haven't, and if you are taking your board exam in the next 30 days, I would really recommend joining our PMHNP last minute preparation. It's a 6-hour high yield review for ANCC and ANP boards on July 25th, 9 a.m. Pacific Standard Time. It's 6 hours. You're going to have breaks like 10 minutes every hour, and we're going to have like a 20-minute lunch break, but it's high yield. It's very important. It's very fast paced. We're only going to focus on a very important thing that may come out of the board exam. Heavily tested common topics that's high yield on the board exam. So it's if you're taking the ANC and ANP, go ahead, please subscribe. You can actually enroll now by scanning the QR code. And also, Past Review came up with a new website. And guess what? You can sign up right now for free. So we're opening the doors to our beta website and would love you to be among the first to explore it. I actually made an account myself and I've been using it just to practice. Okay, you can create your free account and start checking out some of our new learning resources. It's going to have daily PMHNP quizzes, interactive practice games, high yield study materials, board prep resources, and more features coming soon. Yes, it's very, very useful. We have a couple of students already who have signed up and they've been enjoying it. I'm enjoying it myself. It's fun because it's like I may or may not take the ANP board exam. I'm already ANC certified, but just for fun, I might take it. So we'll see. Um, yes. Welcome, welcome. And please share this. This is a free session. We don't charge for sessions like this, the hourly. We do it twice a week. But because of course with schedule, sometimes you have to make some adjustments. So I do really recommend to subscribe on our mailing list so that you get updates on when we go live all the time because this is free resources. Every time we go live, we break down like the 10 questions, like different high yield topics, but every day is a different focus. Like last time we talked about bipolar depression and antidepressants, and then today we're going to be doing the second part of our antipsychotics. Yes, if you are not also a Past Review Center subscriber, your current account and study. If you are already a Past Review Center subscriber, your current account and study platform will continue to work as usual. So you maintain your login credentials, pretty much the same. So you can keep studying without interruption. So as a thank you for being part of the Past family, you'll receive complimentary full access to the new website when it officially launches at no additional cost. But this is for our current students who already signed up before the beta website. All right. So if you have signed up before, scan the QR code and use the same login credentials. We have more viewers today. Welcome, welcome. And those, if you haven't bought it, it's pretty much on demand. We ran out last time, but I think we just have we refilled our copies. So Past Review Center, the PMHNP study collection. If you're that kind of person who likes to touch something that they study, which one, Johnny Day? Which one are you referring on the website? There is a test. It says you have to go to study, and there will be quizzes. If you are having issues, go ahead and email our back office so they can address it. Yeah, there is a study tab where you can answer questions. But if you are having issues, just go ahead and email our back office for that. Okay. Um, okay. Yeah, just go ahead and email them. You're welcome. Yeah, so if you're that kind of learner who likes to touch something that they study, if you like to make drawings or like scribble on it, I would really recommend this study packet, the study collection, the PMHNP Masterfield Clinical Concepts, PMHNP Mastery Psychopharmacology, and the Rise with Pass. When I was studying for the board exam, it's the Rise with Pass. It was the first edition that came out. It was really helpful. There's like questions, a lot of mnemonics. If you are like a visual person, there's a lot of graphics. It's easy to memorize or remember. Um, Even if you're already a graduate or already a pastor, you're already starting to practice or just waiting for a job, I would really recommend PMHNP Masterfield Clinical Concepts and the Psychopharmacology. It's very, very important. Let's accept it. We didn't really get a lot of like, if you are fortunate enough that you were able to like have great training during your clinicals, but I feel like it's still not enough when you are starting. We still need a lot of learning. I keep learning, I keep on studying, even if I'm already done, I'm done with the board exam, I still continue to study. So I would really recommend even if you're already a pastor. Okay, let's go ahead and start. Question number 1. Which patient requires the closest metabolic monitoring? Letter A, patient beginning in ziprasidone. Letter B, patient beginning in aripiprazole. Letter C, patient beginning in lorazepam. Or letter D, patient beginning olanzapine. Go ahead and type your answer on our comment box. Look at all these medications. What kind of antipsychotics are they? What's your answer? What's your answer? Is it ziprasidone? Remember the Z in ziprasidone? Is it aripiprazole? Is it lorazepam? Or is it olanzapine? The answer is letter D. You guys are correct. It's the olanzapine. So all of those medications were second generation antipsychotics. The question asked the closest. You really have to monitor closely. The answer is your olanzapine. It is the big O, okay? Because it carries the highest risk of significant weight gain, high blood sugar, and high cholesterol among commonly prescribed second generation antipsychotics. So olanzapine is notorious for that one. So these changes can quickly lead to metabolic syndrome, which highly increases heart diseases and diabetes risk. Among these four, okay, on these four medications, which one do you think you really need to have a baseline EKG? I'm going to change the question. The same options. Which among the second generation antipsychotics you need a baseline EKG? Anybody? What's the answer? Mm-hmm. Mm-hmm. Yes, it's the ziprasidone. It's known for its QT prolongation. All right, good job, everyone. Okay, let's go to question number 2. A patient taking risperidone develops galactorrhea. Which medication is least likely to increase prolactin? Letter A, aripiprazole. Letter B, haloperidol. Letter C, paliperidone. Or letter D, risperidone. Type your answer in the comment box. Heidi said it's A. John said A. Anybody else? What's the answer? Yes, the answer is letter A. It's your aripiprazole. Because it is a partial dopamine agonist, making it much less likely to cause hyperprolactinemia and sometimes useful to reduce it. The so because typical antipsychotics, they strongly block dopamine. This acts like an off switch of the brain, causing prolactin levels to skyrocket. Meanwhile, aripiprazole is a partial. It is just partial dopamine agonist. So it partially turns on dopamine receptors. It mimics natural dopamine just enough to keep prolactin levels. Good job, everyone. Okay, let's proceed to question number 3. Before starting clozapine, which assessment is the highest priority? Letter A, ECG. Letter B, lipid panel. Letter C, ANC. Letter D, weight. This is high yield. This is very important. You need to have a close monitoring for this. Anybody? What's your answer? Remember clozapine. Which assessment is the highest priority? Okay. Yes, the answer is your ANC. Because many baseline assessments are appropriate, but ANC is required before clozapine initiation because of agranulocytosis risk. The word highest priority is the key. So remember, clozapine, you have to count your leukocytes. Okay, it has to be close monitoring because you don't want to push your patient into agranulocytosis. What is the reason why clozapine is notorious for this? Because the liver breaks down clozapine into a highly reactive chemical called anitrinium ion. I'll try it. Anitrinium. How do you present? Anitrinium. Nitrinium ion. That's a chemical that breaks down. Okay, so this toxic byproduct can stick to white blood cells, tricking the body's immune system into destroying its own infection triggers. Okay, so some people have a genetic, also for some people, there's like a genetic predisposition that makes their bone marrow extra sensitive to cellular stress, but mostly because how this medication attaches It affects the white blood cells. So when your white blood cells increases, you're at risk for having infection. Okay. All right. Let me ask you on top of your head, what are the signs and symptoms that you have to educate your patient if you're giving them clozapine? Give me 3. Type it on the comment box. 3 signs and symptoms that you have to educate your patient to watch out for if you are prescribing your clozapine. Give me 3. Yes, fever. What else? Signs of infection. What are the signs of infection? I feel confusion's already late. Yes, it could be, but it's already late. Mouth sores, yes. You have to have really good education. You really have to tell your patients. I'm looking for one word. Yes, weight gain, because it is, of course, like an antipsychotic. What signs of symptoms? Mouth sores, what else? Increase in temperature, fever, what else? Flu-like symptoms. That's what I'm looking for. That's a very common word that they used on the board exam. Flu-like symptoms. Pain or burning, any sign of infection. Okay? Flu-like symptoms, mouth sores, or sore throat. So you have to educate your patient. Once they start feeling something like that, they have to report it right away. Okay? All right, let's go ahead to question number 4. A patient receiving haloperidol presents with temperature of 103 degrees Fahrenheit, generalized rigidity, elevated CK, confusion. Which diagnosis is most likely? Letter A, serotonin syndrome. Letter B, malignant hyperthermia. Letter C, neuroleptic malignant syndrome. Letter D, acute dystonia. What's your answer? This is high yield. You should know this by heart. You should know this by heart. What is it? Yes, the answer is letter C. You should know this by heart. Know this by heart. Okay? Neuroleptic malignant syndromes. The hallmark is lead pipe rigidity with dopamine blockade. But let's go back. Let's talk about test taking strategy. Okay? It's going to require new basic knowledge. For example, you don't know. But I'm expecting you guys to know this because this is very important. It's an emergency. If you see this. A patient receiving haloperidol. That's your first keyword, okay? Haloperidol. It is an antipsychotic, all right? Temperature increase, generalized rigidity, elevated CK, and confusion, which is most likely. So basically, your main keyword here, the patient's taking haloperidol with fever, elevated CK, and generalized rigidity, okay? Is it serotonin syndrome? Of course not, because there's no SSRIs here. There's nothing serotonin involved because it's antipsychotic. That's your first keyword. So you eliminate serotonin syndrome. Is it malignant hyperthermia? Your basic knowledge would tell you that malignant hyperthermia is triggered by anesthesia, right? So eliminate malignant hyperthermia. So you're left with letter C and letter D, right? C is neuroleptic malignant syndrome, possibly. Is it acute dystonia? I don't know. Maybe because it's also like it is a side effect, an adverse effect when you're taking antipsychotic. But your basic knowledge would know that acute dystonia is a movement disorder, right? From an antipsychotic. Is there anything on the question that tells you that it is a movement disorder? Probably a generalized rigidity, but no, it is not. So, temperature increase, rigidity, elevated CK, lead pipe. If you see those words, you'll think right away neuroleptic malignant syndrome. That's how you're going to attack each of the question in the board exam. Okay? Even sometimes, even if you don't know, you have 50% chances of answering the question right away if you know how to eliminate, the process of elimination. Got it? All right. We have 7 minutes left. We are on our last question. Which medication is most likely to prolong the QT interval? I gave it away. I gave it away. I forgot. Letter A, aripiprazole. Letter B, ziprasidone. Letter C, lurasidone. Or letter D, clozapine. Type your answer. If you're listening earlier, you would get this answer right away. The way I remember this is Z because the Z on it. Yes, okay, the answer is yes, I gave it away already earlier. I forgot. It's your ziprasidone. The way I remember this is the Z. You know, your EKG looks like Z's. So it's ziprasidone. So ziprasidone is a classic SGA associated with QT prolongation. Among first generation antipsychotics, IV haloperidol and thiazidine are also high risk, but the board Pearl would usually ask for ziprasidone. So zips the QT longer. So ziprasidone increases the QT and a prolongation risk. So, okay, let's go back. Let me change the question. Which among these medications can be used to treat depressive phase of bipolar 1 disorder? Okay, ignore the question. It's a different question now. The same choices. Which of this medication can be prescribed or can be given to treat depressive phases of bipolar 1 disorder? Anybody? It's usually given in patients who it treats the depressive phases of bipolar this 1 disorder, and also the patient does not have like suicidal ideation. Anybody? Okay. I like to throw in like different questions. I like to throw in like questions like this. Because sometimes like good options. Let me think. I remember. The answer is lurasidone. So lurasidone, it's a typical antipsychotic that treats the depressive phase of bipolar 1 disorder. However, say for example, the question changes to the patient has like suicidal ideation. As long as, or suicidal, the patient, it's the answer will be the Pearl. For bipolar, the treatment will be always lithium, or it protects them from suicide. It's always lithium. But if it asks you for an atypical antipsychotic that is can be used to treat the depressive phase of bipolar 1 disorder, the answer will be lurasidone or Latuda. Yes. Yeah, so kind of works by balancing the chemicals like the serotonin and dopamine. So you always, for patients who are on Latuda, you have to make sure that you inform them that they have to take it with food. Yeah. So it's specifically what's the term that I was trying to remember? It specifically is designed to lift the mood without triggering mania. That's what lurasidone does. Yes. So for bipolar 1 disorder, if the patient is suicidal, so the gold treatment for bipolar disorder is lithium, and it is specifically to prevent like suicide. However, if the question asks for an atypical antipsychotic that can be used, you see the wordings, it's different, the way we attack. So you have to be very, so when you're taking the board exam, you have to be very careful. You really have to read the question. If you can't understand it, read it again. Okay? Don't just jump into conclusion, and do not, never assume. Okay? So, but if, so the golden treatment for bipolar disorder is lithium. However, if it asked for an atypical antipsychotic that can be used to treat the depressive phase of bipolar 1 disorder, the answer will be lurasidone. Okay? Any questions? All right, I think you guys did a good job. Let me see. And I think we have new viewers. Thank you so much for joining us, and hope to see you again on our next. Oh, yes, yes. What topics do you want us to discuss on our next live? Some people asked us about theories, so we're probably gonna do that. Any topics that you would like to see on our next live sessions? Okay, if you're thinking, if you are enjoying our live free sessions, please help us grow our community. Of course, for us to continue what we are doing right now. Inducers and inhibitors, okay. Theories, okay. We'll take note of that. I actually, for inducers and inhibitors, oh, theories and therapies, okay. All right. We'll do that. Thank you for joining us today, and hope to see you again on our next live review. Please go ahead and subscribe, follow us on our social media, follow Past Review on Facebook, Instagram, LinkedIn. Maraming salamat po sa lahat ng mga kababayan who are joining us today. Please don't forget to share us. We have so many students already that passed the board exams, and I really love, like, those messages that they sent us. So please you will be the next passer. All right. Have a good day, everyone.